welcome to St Tammany Parish Hospital's Pediatric Emergency Department. My name's Katie, and I'm one of the registered nurses that works in the Pediatric ED here at St Tammany. We're happy to show you a little bit of what we have here. It's brand new, and we'll start with, this is our Pediatric ED waiting room. If you look around, it's kid-friendly, it's separate from the adult section, and we even have a television while you have to wait for your room. Next, we're going to go into the unit and take a look. Our unit is separate from the adult side. We have 5 beds that we could treat pediatric patients. The hospital discovered that 1 out of every 5 patients that checks in is a pediatric patient between the ages of newborn to 18 years old. So we've opened this up so that we could have some specialized care for pediatrics on the North Shore. Come this way and I'll show you one of the rooms. All of the rooms are private, so no sharing between families. This is an example of one of our pediatric rooms. We have bright colors. It makes it a little bit more warm and inviting for children so they're not scared or worried. We also have an in-room bathroom, which most ERs don't have, so that it makes it convenient when the little ones have to use the restroom. You're not having to bring them all through the hospital. We also have televisions in every room so that we can keep the little ones entertained. Sometimes while waiting for lab results to come back, it could take some time, so we try to keep everybody entertained while you're staying here. We'll take a look a little bit more. Some more friendly artwork so the kids don't get nervous while they're here. We even have small wheelchairs for some of our orthopedic patients that come in with broken legs or foot or fractures or sprains, so that they're not sitting in a giant adult chair. Come through this way. This is the nurses' station, where we have full view of all of the rooms that are available. We also have cardiac monitoring so that we can view anybody who needs to be on a cardiac monitor from the desk. We have a nourishment station where we've got different types of infant formula. We also have popsicles and juices and things that kids are more interested in eating and drinking while they're here. Sometimes if they come in with a stomach virus or they've been vomiting, they're not interested in eating or drinking, and sometimes we need to see if they're able to tolerate it. So we have a lot of kid-friendly products in our refrigerator down here. This room is mostly what we use for our orthopedic room. This one is larger than all of the other rooms that we have on the pediatric unit, and the reason being is because sometimes when we have large bone fractures and the orthopedist has to come in, we have to get more equipment in here to have x-rays at the bedside. So we use this room because it can accommodate more equipment at that time. This one also has its own personal bathroom, and it can accommodate anyone that's in a wheelchair, so it's plenty of room.
And is that also convenient for parents who don't want to leave their children, need to use the restroom?
Absolutely, absolutely. That's why they have it in mind, because sometimes you're one parent with one child and you can't leave. So they definitely thought about all of those details when they were building this pediatric unit to make it friendly for the family. Sometimes you have to come with all of your children because you have them all, and emergency happens when you least expect it. So we have a bigger room to accommodate larger groups that are here, so that everybody can have a place and feel comfortable while they're here.
Mm-hmm. And I guess, what kind of access to physicians? Are they all pediatricians, pediatric specialized physicians that come?
The physicians that work in our pediatric ED are all experienced pediatricians in emergency care. So they are very well trained, tons of knowledge, and it is pediatric specific. So you'll find that your wait time here is much shorter than anywhere else, and we treat the pediatric patients a little bit faster than you might see at another emergency room, because we narrow it down. The pediatricians know exactly what to look for, exactly what to test for, and it also saves you a lot of over-testing. Sometimes in outside emergency rooms or non-pediatric specific emergency rooms, you wind up testing for many things that are unnecessary. So we try to only have to test what we need to test for to make sure we find out what's causing the illness or injury while the pediatric patient is here.
Okay. And are all the nurses pediatric specialized as well?
Yes, all of us, and 2 full-time RNs. Lance is my counterpart. When he's not working, I'm working. Lance has worked in the emergency department at Children's Hospital for 20 years. So he is about as specialized as they come. I have critical care background in pediatrics, mostly in ICU settings, for over 11 years. So there's not too much that we haven't seen, and we definitely know how to take care of the little ones when they come in and they're not feeling well. And the biggest thing is try to make the family and the relatives and the parents comfortable, and letting them know that we are taking care of their child with a lot of experience.
Okay. And what hours is the pediatric area open?
Currently, we're open 7 days a week from noon until midnight. We are eventually hoping to become 24 hours with the use of this video and getting word out there and letting everybody know that we're here. The biggest thing that we hear when our patients come in is, 1, they didn't know that this existed, and 2, how much they loved it and enjoyed their experience here. So we really want to get the word out so that everybody knows that we're here to treat your kids, and we can have a 24-hour service for you guys.
Okay, great. Thank you. Is there anything else? All right.
There you go.
Thank you, everyone, for joining us for our tour. And if you need emergency care, you know where to come.